Hello everyone. I am drberkkkaratas. In the first video, we defined erectile dysfunction. In the second video, we talked about the reasons. In this video, we will talk about the treatment steps in erectile dysfunction. We have a serious treatment plan for erectile dysfunction, which is called step-by-step treatment. It consists of the first step, the second step and the third step. The most common form of treatment in primary care is medication. Of course, there are many reasons why this happens most often. We all know this. These medicines can be sold without a prescription. These medicines can be bought on the internet. There are fakes. They have their own. They have real ones. Therefore, it can be bought directly from the pharmacy with the recommendation of a friend. That's why it's used a lot in an uncontrolled way. Maintenance therapy is one of the oldest treatments. It has been used since ancient times. Of course, it is recommended to use more drugs or shock waves together, not alone. Another new treatment is shock wave therapy. It has been used in the medical community for 4 to 5 years. If it is applied to really suitable patients, very good results can be obtained. If we do not get results in the first step, we will move on to the second step. Our second-line treatment is needle therapy. It consists of the treatment that the person does to his penis before intercourse, the injection he makes. There is a serious difference between needle therapy and second-line treatment, and first-line treatments. And that is, when we take medicine, we need to have a sexual desire, or when a shock wave is made, we need to have a sexual desire. Otherwise, we do not have an erection. In the needle treatment and the second-line treatment, hardening occurs reflexively. In other words, after you make the injection, whether you have sexual feelings or not, an erection occurs reflexively. Of course, this seems to be a good situation, but one of the biggest problems of needle therapy is that an average of 60% of patients stop treatment for some reason within the first 6 months. If we are successful in second-line treatment, then we move to the third step, which are penile prostheses. Penile prostheses are one of the treatment steps that we get the most obstacles in treatment. The reason for this is not in the patients, but in us. I believe that we could not explain the penile prosthesis treatment to the patients correctly, we did not spare time and we could not explain it properly. Therefore, we often encounter a serious obstacle in the treatment of penile prosthesis. There are also these treatments as information in these treatments book. So when we open the books, we see them. We also have 2 more treatment methods at the moment, which have not yet been added to the treatment steps, but I believe that they will be added here in a very short time. The first is PRP treatment or P-shot treatment. Especially in the USA, PRP treatment has been performed in addition to shock wave therapy in the first step for the last 3 to 4 years and very successful results have been obtained, and I think it will be added to the first step in the near future. The second treatment is stem cell therapy. Animal studies of the root treatment are over, preliminary reports have been released in human studies, and the place where it will be added will most likely be between the second or third step. In other words, if patients apply all the treatment and do not get results, then stem cell therapy will be evaluated as the last chance before going to the prosthesis, and as a result of the studies, it is determined that 60% of the patients get rid of the prosthesis treatment. I believe that this will be added to a region between the second step or the third step in the near future. In our next video, we will talk about drug treatment in first care. Thank you.